All right. All right. So our vision, I don't know if there were any of you that were in our last meeting that we had, but this might be familiar to you. But of course, want to start off with Buckeye's vision. We have been providing government-sponsored benefits since 2004 in Ohio. And our mission is to transform the health of the community one person at a time. And currently, we're doing that by serving more than 300,000 members in the Medicaid, Medicare, and Marketplace products in Ohio. And we are headquartered in Columbus. Um, I think it's important for you to know what the member ID cards look like as you're serving the members. You're getting that information from them. So we've got a sample here of the ID cards for our Next Gen MyCare population. They are a little bit different than what we had before. So this first example that you'll see here at the top, this is a WellCare Buckeye MyCare dually aligned member. And what that means is that Buckeye is managing both the Medicare and the Medicaid benefits for the members. So this is what we called in the demonstration before NextGen rolled out. This is what we called an opt-in member, but now the new terminology, of course, is this is an aligned member. So when you see this card with, it's got, more information obviously than the second example. This is someone that we're fully aligned on their benefits, meaning that we're managing the Medicare and Medicaid for them. The second example here is for a Medicaid only member. So that means that Buckeye is managing the Medicaid for the member only. And this, of course, is where the waiver benefit is coming from, is out of those Medicaid benefits. It stems from the Medicaid benefits. So if you are managing one of our members and you see this card, you'll see that, again, it says Medicaid only. It's kind of called out there. And so that means that the member either has fee-for-service Medicare, that's just going straight to, the CMS to government fee-for-service, or that they have another MCO that is a MCOP that is managing those Medicare benefits. So provider enrollment, credentialing, and contracting. So important stuff. We want to make sure that you know how that you can contract with us. We're currently in middle of May. August will be here before we know it. So we want to start that process as soon as we can so that you're aligned. And although Buckeye is not accepting new members this year in 2026, if we do have members that move into your area, that region there that's served by Buckeye Hills, we can follow that member and maintain their benefits. So you won't see new members from us, but you would have the possibility of one of our existing members moving into your area and being able to provide that service. So ODM credentialing, obviously, to provide these benefits, you need to be certified through ODM. I'm sure you all are familiar with that process. We've got kind of like, that oversight there, and then the OAC rule that goes over provider types that require credentialing. And then contracting with the MCOs. So you begin contracting with each MCO once you have a Medicaid ID. So once you've gone through that, credentialing process with the state, then you can move forward with contracting with the MCOs. And again, I know there has been some confusion. I've kind of gotten some feedback from some of the providers that I've spoken with where they think that, you can contract with one MCO and it kind of goes across the board. Very important to know that when you provide benefits to MyCare members, you do need to be contracted with each MCOP. Those are individual contracts that you will go through. The good news is essentially the information is the same because it kind of goes, we've got guidance that's provided by the state on what we need to receive. So the good thing is once you get that packet of information together that is required to contract, it's going to essentially be the same for each MCOP. So you're going to take that information that you've gathered and as you work to contract. And Buckeye does have online, become a provider that is online. So it's very simple. The hyperlink will be in this PowerPoint, which you guys will get after the presentation. So you just click in, it walks you through and you initiate that process online. So credentialing is centralized, again, through ODM. You're just going to ODM to provide that service and become credentialed. But the MCOs contracts are still required and those are individual. And then when submitting an application in PNM, you can designate the MCO interest. So that means that when you go into credential, you can let them know who that you are interested in credentialing. You still can go beyond that. I would advise, even if you don't have the intention of contracting with all 4 plans, you might as well just go ahead and indicate that with ODM. That way it's there. I think you still can contract, even though I think it's really just information gathering when you do the credentialing process with the ODM, but still, just they'll ask for which you can designate which MCO that you're interested in contracting with. And then provider demographic data is transmitted to the MCOs for contracting. So when you do provide that designation with that credentialing, they will notify us, and then that allows us to follow up as well. But you still will need to, initiate that contracting process online. So once you initiate enrollment in the ODM PNM system, you can visit our provider page. So anything that you see here that is underlined and has that different color font, there is a hyperlink. You can see it brings up a hyperlink. So if you hit control and click on that, it's going to take you right to that web page. So the provider homepage obviously is one of those hyperlinks. And then the become a provider, this will take you to the provider homepage. This will take you specifically to the become a provider to submit a contract request on there. So if you're a non-participating provider that is enrolled in Ohio Medicaid and registered with Buckeye, prior auths are required for all services. Really with waiver, we do require prior auth for all waiver services. When we would see you come into Buckeye as a non-participating provider would be if we have a member, or if you have a member that you've served under another plan, and that member transfers to Buckeye and you have not had that time to contract with us, you would come on board as a non-participating provider as a part of that transition of care period for that member. The member has 6 months to maintain those services that were in place and the providers that have been providing those services. So during that time, you can work with that member as a non-participating provider. And if you are going to maintain that member, you'll want to initiate that contracting process during that 6-month time period. And then participating providers, of course, are enrolled in Ohio Medicaid, contracted with Buckeye. And then they've got prior auth for some services, but again, with waiver, all of our waiver services require a prior authorization. We do have a prior auth tool that the link is here. You can go in and answer, go into what line of business, which of course, this line of business that you'll be serving will be the MyCare population. You can put in the procedure code and it will tell you if a prior auth is required if you, are not sure, or if you are serving the Medicaid population as well and you want to check on, those procedure codes as well. And then there's more information here, again, a hyperlink to give you answers to more frequently asked questions. So waiver providers, the classification to be a waiver provider, you're authorized either by the Ohio Department of Aging or the Ohio Department of Medicaid. So if you are certified with either one of those, which most of you are probably certified with ODA, I would say, or AGE, that you won't have to worry about recertifying to become a MyCare Next Gen provider. So you're good if you've got that certification, or if you've got the Ohio Department of Medicaid, if you are already serving Medicaid members as well. You're enrolled in Ohio Medicaid, registered with Buckeye, and then prior auth required per the member's person-centered service plan. And that's the big difference, one of the big differences that you all will see, where before these services with Passport and Home Care, they were entered in, and I can't think of the system quick enough, but they were entered in by that care coordinator into that system, and then you went in as a provider to bill. This is going to be different in that with our members, they are case managed. They have a case manager at the plan, and then if they're 60 or over, they've got a waiver service coordinator with the AAA. And the initiation of any waiver service starts with the assessment of either of those individuals, depending on the age of the member, and the assessment of that member initiates that process to identify what services that the member needs. And then those services are put onto a person-centered service plan. Once that is completed, along with the other assessments, that service plan comes to our waiver department, and they review those services for medical necessity or functional necessity, and then an authorization is completed. And then you receive, as the provider that's identified on that service plan, you receive not only a copy of that authorization, but you also receive a copy of that service plan, so that you can see the amount of that service. Well, the type of service, B, the amount of service, and then how that service is to be delivered. So you're going to see, how many units or the hours per week, and then you're going to see the schedule that either the care coordinator or the service waiver service coordinator has come up and put on that service plan. And then that schedule, of course, it's identified so that we know how that service is being delivered, but of course it can be modified to meet the member's need if they have an appointment or something comes up and they need to change that. And then we go into independent providers because those look a little bit different, obviously, than agencies. So we've got a hyperlink there for resources for independent providers. And then we've got the Next Gen MyCare product training. So this will go in and give you, and all of this again is on that provider page that you're going to, click into there on the provider homepage. So, we on our website, we have a lot of resources that are, self-paced learning to where you can go in, you can, look at these resources, if it's like a PDF or, a presentation, you can save those and have those, or, just have those bookmarked on your web pages so that you have a quick resource for that. All right, so Buckeye, and I think all of the plans have done the same, but Buckeye, we have delegated the AAA to do waiver service coordination for our members that are aged 60 and older. That again is done by Buckeye Hills, and they will oversee the waiver service coordination for that member, meaning that they're going to identify the needs. They are going to be completing that service plan and overseeing the waiver services for the member and the assessments that go along for that member, their health risk assessment, and the other assessments that go, any transitions of care that they have from a hospital, from the community into the hospital to long-term care, LTAC, any transitions, that those will be overseen by the service coordinator, which is located and employed with the area agency on aging. Any member that you have that is 59 or younger, the Buckeye care coordinator will serve not only as the care coordinator for their other medical oversight and coordination of benefits, but they will oversee the waiver service coordination as well. So 60 and over, your point of contact for the waiver service benefits is going to be the AAA waiver service coordinator. And both of these parties are going to be identified on that service plan that you're going to get. So if there's ever a question on the service plan that you receive, it's going to have that identified. And then 59 and younger, of course, is the care coordinator here at the plan. If you ever have a question and you're not sure, you can always reach out to the plan. You can ask for the care coordinator. Every member, no matter what the age, if they're the services being managed by the AAA or if it is being managed by the plan, the service coordinator at the plan, both those groups of folks are always going to have a care coordinator at Buckeye. So if you're unsure, you can always reach out to the plan and we can connect you. Member services or provider services can connect you with the care coordinator for that member. Waiver service authorization. So we kind of spoke to this a couple slides back. So all long-term services and support waiver services require a prior auth through the person-centered service plan. Service plans developed in collaboration with the member, their family or caregivers, and their providers, ensuring services are individualized and medically necessary. And then authorizations must be obtained before services are rendered. Waiver auths are built based on the service plan, and you want to make sure that you verify via the service plan that the auth is yours prior to submitting claims. So again, on this service plan, You are going to be identified as the provider. It's going to give the procedure code for that, and it's going to say what service that is. It's going to identify you as the provider, and then, of course, the service amount, and then the scope of that service plan. It's going to tell how that service is to be delivered. So again, this is going to be different than what you're accustomed to. You never want to initiate services, and this is with any MCOP. You never want to initiate services without having a prior authorization in your hand, because that's the guidance that we have. All of these services require prior auth. You don't want to risk not getting paid. If there is a circumstance that an extenuating circumstance for the member that you're serving to where this needs to be expedited. When we look at waiver authorizations, the prior authorization process, it's different than medical services, traditional medical services, because there's not urgent, expedited, and those, I mean, all are done at a standard review. But if there is something going on with the member and we need to get this through a little bit quicker than the 7 days that are allotted from the initiation of the service, from when the service plan is submitted to the initiation of service, please let that service coordinator know so that the service coordinator or the care coordinator can communicate that back to the department. And then for any additional details on billing and auth requirements, you can visit the provider training resource page under provider resources there. Provider responsibilities. So, this is what I would call common sense, but, we want to make sure that we have this outlined. We follow the same guidance as we do with any other areas of services, with the plan or, health benefits. We want to make sure that the provider protects member privacy. We want to maintain confidentiality of the PHI for the member in compliance with the state and federal laws. Deliver quality services. We want to provide all covered physician services, including telehealth, which you guys aren't going to, this group won't be doing telehealth, but all services with accepted clinical, legal, and ethical standards, consistent with licensure training and qualifications. And there's more on that in the provider manual. Ensure access to care, maintain sufficient facilities and staff to provide cover services as they are needed, meeting Buckeye's appointment availability and access standards. And then after hours access, we want to make sure that if our members have needs that fall outside of normal business hours, that you have a protocol for them to be able to reach you with after hours availability. Cultural competency, we want to make sure that the providers are tailoring care and supports to meet the social, cultural, and linguistic needs of each patient. And of course, we serve a diverse population with limited English proficiency at times, and we want to make sure that those and the individuals that have any kind of disability or barrier, you've got a way to overcome those barriers and meet those members at their point of need. And Buckeye's approach is we maintain our culture competency plan that monitors language services, transportation services, and then reasonable accommodations for members with disabilities. And then shared responsibilities that the providers have with Buckeyes to inform members of available services at no cost, provide diversity and cultural competency training to staff, and then promote a diverse and inclusive workforce reflective of all of our members that we serve. Waiver provider signature requirements. So we kind of talked about the waiver service plan that you're going to be getting that outlines the services that you're going to be providing for the member. So in accordance with the Ohio Administrative Code, there is a requirement for you to acknowledge that the receipt of that service plan. And that is, multiple fold to make sure that you acknowledge receipt of that service plan so that we know that you received it. Also to acknowledge that you accept the, those services and the assignment to that member, and that you're able to provide those services. And then to make sure that, you're aligned with that and are able to provide those services. So it's very simple. It's not a physical signature. In our provider portal, you are able to go in, and this is part of the provider orientation, so we won't walk through it now, but essentially you're able to log into the provider portal, go into that member's record, and it's just answering a few questions, acknowledging receipt of that person's service plan, and then it creates a document that then from the portal goes back into that member's chart and is housed there to where we can go in and see that you have signed the acknowledgement of that. And if you click here, that there's a little bit more to that, the provider signature education. There's also the OAC rule that is the reference for that requirement for those signatures. There we go. EVV, electronic visit verification, that's required for Medicaid covered home health and personal care services to verify visit details. Agencies, providers can use the state system SANDATA or an approved SANDATA or an approved alternate system. And then any independent provider has to use SANDATA. Claims require the EVV data to be in there, or it will deny. We have to verify that we've got that in there, that information has been received for the claim to be validated and paid. And then we've got just the support numbers for you on those, the 1-800 number as well as email, and then the ODM EVV website to provide more information if needed for you. Transitions of care. So your role as the provider with transitions of care. So these transitions of care that we're talking about is, anytime that there is a disruption of the member's care that is caused by either, some kind of interruption in their home. So if you're providing supportive care to a family member that's there, maybe the family member works during the day and you're going in during the day to provide supportive care. If something happens to that family member and there's a change and, that dynamic, and then be able to provide that supportive care. If they, go to the hospital, if they, anything that happens that interrupts and impacts that service delivery, it's very important that you communicate that to either the care coordinator at the plan or the waiver service coordinator. Why? And the why behind that is that, we need to make sure that that member is not, there's no health, safety, or welfare issue that is caused by that interruption or transition of care and that impact to the service delivery. So it's very important that, anything that occurs within the member's home that's an interruption of what their normal is, that you communicate that to us so that we can intervene, make sure that everything's okay with the member, and then, look at, if what is in place still is meeting that member's need. And then, when that happens, we're going to update to reflect any changes of the member's condition and service needs. And then backup plans, one of the requirements for, participation in waiver, as you all know, is that the member must have a backup plan. So we want to make sure that the providers that you maintain that backup plan to ensure service continuity and member safety. And then collaboration, we want to make sure that you engage with waiver service coordinators and Buckeye and discharge planning and reassessment. You guys see our members more than, anyone else, because you are in their home, you have those relationships developed. So you really are our eyes and ears when it comes to the day-to-day goings on in the member. So it's very important that we collaborate, that we have an open line of communication so that we can make sure that, the members' needs are being met and that we can support you as needed. So it's very important that, we keep those that communication open. And then incident managing and reporting. So any incident, an incident is any actual, alleged, suspected event that deviates from routine care or service and must be reported. You want to immediately report serious incidents such as abuse, neglect, exploitation, misappropriation, or death. And then all other incidents must be reported within 24 hours or sooner if required by law or license. We ask that upon discovery that you report to us, just again, so that we can intervene as quickly as possible. You'll want to notify the member's care coordinator. So, either the waiver service coordinator for members that are age 60 and older, or the care coordinator at the plan for a member that is aged 59 or younger. and the appropriate authorities as needed as soon as the incident is discovered. And then we ask that you cooperate fully with any incident investigations. So again, we want to make sure that we get this information from you as quickly as possible. If you are unsure, again, if you're unsure if it's, a care coordinator at the plan for the member or the waiver service coordinator in an area agency on aging, just, reach out to someone, reach out to the plan so that we get that information from you. And if it is, a member that is 60 or older, they will direct that to the service coordinator. But the important thing is that, we get this information as quickly as possible so that we can intervene as quickly as possible. Provider conditions of participation, I'm not going to read this word for word, but this is based on OAC Rule 5160-4431. This just goes over, the conditions for you to be a waiver provider. Again, it's housed in the OAC, so you can take a look at that. This kind of just gives the highlight from that rule. And then how to contact Buckeye, obviously very important information. So we have a provider service designated line that are available Monday through Friday from 8 until 8 at night, 8 in the morning until 8 at night. You also, that provider portal that we were talking about, you could log into the portal and send a message there. There's like in the top right corner, I think it is, there's like an envelope for you to click on to send a message. And then you can, once you complete that message, you want to allow 3 to 5 business days for a reply. And then provider engagement. So our provider engagement team is, they're dedicated to making your experience the best and a positive one and supporting you, especially in this initial rollout. We want to make sure that our team works very closely with you as you develop this relationship and develop your skills in working with this population as far as, service delivery and claims experience. So these provider engagement folks, each zip code is assigned a provider engagement account manager. And unfortunately, Rebecca Morrison was supposed to be here today, but unfortunately she was not able to join me. She's out of the office unexpectedly, but on the last slide, we'll have her information as well. So I think for the area that Buckeye Hills serves, she is over all of those zip codes. So we'll have her information at the end of the presentation, but she can assist with maintenance of existing Buckeye provider manual, network performance engagement, physician and office staff orientation. So again, this would be office staff orientation, or if you're an independent provider, your orientation with the plan. And then ongoing provider education updates and training. So if you have questions on claims, if you have questions with the provider portal, they're able to give that support. They can log on with you, screen share, kind of help you with that. And the goal, of course, is to furnish you and your staff with all the necessary tools to provide the highest quality of healthcare to Buckeye enrolled membership. So we want to be the best partner to you possible, make sure that we're meeting, not only our members at their point of need, but our providers as well, because, we are depending on you to provide the best of care to our members. And part of that partnership is, as you deliver that incredible care, is to partner with you to make sure that, your needs are getting met and that, you're having any questions that you have answered or any support that you would need, we're providing that to you. So this is the final slide. Thank you all for your time today. Can't say enough how much we appreciate you, showing up this morning. As Jen said, we'll go into like a Q&A now. Please ask any question that you've got. I guarantee if you're thinking it, someone else is. Understanding that this is a new process, there's a lot of different things. We want to make sure that, we answer any questions you've got. If you don't want to come off mute, maybe if you're a little bit backward this morning, or if you think of something later, this is my contact information and then Rebecca's as well. Reach out to us. Our emails are on there. You can call us. Our phone numbers are on there. Don't hesitate to reach out individually to us as well. We're here to support you. Again, especially this year, we're always here to support you, but this year, especially because as you move into this area and serving this population, we want to make sure that you're comfortable in doing that, and whatever we can do to support that, is what we want to do. So, thank you for your time. I'll turn it back over to Jen.
Okay.
and we will go from there.
We've got some questions in the chat. We'll start with those, and I'm sure those questions will lead to more questions in the chat.
All
Also,
right.
if you want to just raise your hand, once we get through the chat questions, we can call people out by hands raised. So the first question, are these authorizations and service plans emailed to the providers? How is this communicated?
Great question. So if you are with an agency, those are faxed over to you. So when you onboard, you will provide a fax number as well as your contact information, your contact number. And so the service plan and the authorization will be faxed to you. If you are an independent provider, it will be emailed. But part of our policy and our procedure is that for any agency provider, those are faxed. So you'll get those faxed to you, a copy of the service plan along with the authorization. Both of those are also available on the portal as well. So you can access, going into the portal, you can access the member's information and you can go into there and under assessments, you'll see that waiver service plan. And then under authorizations, you can pull up that authorization there as well. But our process is as we review those services and approve them, those are faxed over to agencies.
Okay, so I'm going to kind of roll this up into one. When does a provider for waiver request a prior authorization? Do you request prior authorization monthly? And will we have to do prior authorizations on existing residents that are currently on waiver?
Great question. So here's the good news. As a provider, you will never have to request service for a waiver service. If you are providing waiver and Medicaid, with your Medicaid, you're still doing that prior auth request, that traditional prior auth process. But with waiver, that request for service. So if you are in the member's home and maybe a member calls you and says, "Hey, I want you to provide my personal care service. I'm with Buckeye and I'm with, X provider, but I want to come to you." You can get the information from that member for their care coordinator, the waiver service coordinator, or Buckeye care coordinator. And you can contact them, say, "Hey, I was in contact by your member. They want to switch services to me." And they will take care of the follow up with that member. And that outreach and update of the service plan, and you will get it. So you won't have to initiate a prior authorization in that sense. The waiver members that are existing, if they so in 2027, again, 2026 is a little bit different because we're not going to have new members coming on to Buckeye. So if you have a member in 2027 that they're with Anthem and they move over to Buckeye and their existing waiver, that but Anthem communicates to Buckeye that transition, or Buckeye gets the notification from the state. Sorry, I should back up a little bit. We get the notification that that member is coming onto our plan. We can see that they were with Anthem, so then we will retrieve that information from Anthem either via file transport portal or just getting that manually from them, and that service will be initiated during that transition. So with the transition to care, you don't the care coordinators will facilitate getting that service moved over into Buckeye and getting that service plan initiated.
Okay.
Did I answer all that? Was there anything I left out?
Uh, when do they request the prior authorization? Do you
Yes.
request it monthly? And do you have to do it
Okay.
on existing consumers? I think we got
Thank
it.
you. Yeah. Well, okay. So waiver service plans are done annually. So when you look in the OAC, service plan is done annually for the member, and then it's updated as needed. So there's changes that can happen inside those 365 days. But if there's no changes, that service plan goes for 365 days. So on the initiation of that service, with personal care, those authorizations are 3-month authorizations. So there's nothing you have to do inside that time. If there's no changes and that service is staying the same, that review, we'll authorize for 3 months. You'll get a copy of that. And then the team in 3 months will pull that up, make sure it's still on that service plan, and then they will authorize again. So personal care, you're going to get every 3 months, you're going to get an authorization. And there's nothing that you need to do to trigger that that authorization being sent to you every 3 months. The plan does that. Again, if there's nothing that's changed, it's just triggered. The review of that service plan is triggered and then triggered internally. And then we look, make sure that everything's still in place on that service plan, nothing's changed, and it gets sent to you again. If you don't get a service, if you don't get an authorization prior to when that previous authorization ends, then you want to reach out to the service coordinator and say, hey, I haven't gotten an authorization for this. There's, as far as I know, there's been no changes and I don't have an auth in hand.
Okay, that kind of rides into the next one, which is how often should a provider receive the person-centered service plan?
Every time you get an auth, you'll have a copy of that.
Okay.
So anytime that there is an update to an authorization, a new authorization, any changes whatsoever, change in provider, change in amount of service, anything like that, you're going to get a copy of that service plan. So if you're getting an auth in your hand, you should have a service plan as well.
Okay. In regards to EVV, we have a lot of consumers that do not have internet connection and will often use another way to clock in by using the client's phone and then manually signing the care log. Will those services still be paid in that case?
As long as, so if you're logging in and using your phone or the member's phone, I think you can use your own phone as well. It doesn't have to be, you can call in. I can get, if whoever's asking that question, if you want to,
I want to say that in all likelihood, they may be speaking about a landline that because we have a large portion of our area without cell service.
yes.
So I think they're asking in those scenarios when we don't have internet or we don't have cell service, is there another way to verify that service? And if we have to do it manually, will they still be paid?
That you're going to have to file for an exception. And I think you might be able to use a landline. I'll get more information on that. I
If
know
that
that's,
was my question, if you guys don't mind me jumping in, it's
Absolutely
Chrissy.
yeah,
jump in.
yeah, jump in.
So basically, how our system works is if they are not able to clock in and clock out using their application, which is GPS tracked, they
Hmm.
will use the client's landline. We call it telephony.
Hmm.
And it verifies that they were there at the start of the shift and verifies that they were there at the end of the shift. But we have to like attest to that in our system that that was accurate. So the admins attest to that. And then it gets sent over to EVV. And right now, those are currently being paid. So I'm wondering if that will be the same with you all and other MCOs, I guess.
If it's being accepted by, and this is through SAN data,
Yeah.
then it would be accepted by us because the plans aren't oversighting that EVV regulation or policy. That's the state. So, excuse me. So if it's being accepted now at any of the plans, as long as it is validated in that SAN data system, then it's fine. So if
Okay.
it's working now and you're doing it now in 2026, it should be fine.
Okay. Thank you.
If you would have a problem, reach out to us. If it's one of our members, or reach out to the MCOP that the member's with. But if you're doing it now and you're able to validate that way with via a landline, there shouldn't be an issue at all.
Okay.
Okay. As a home delivered meal provider, we use paper route sheets. Is EVV required for home delivered meals?
No, no,
Okay.
your paper route sheets with the member or responsible party signing. Yeah, yeah,
Um,
yeah. EVV is just for personal care
okay.
and home services like personal care.
What is considered timely to notify the waiver service coordinator and Buckeye in change of care?
Define change of care for me. Like, are we talking about amount of service? How they're like, whoever submitted that one, if you could define changing care for me, I want to make sure I'm on the same thought process with you.
All right.
Fall
No.
or decline in care immediately. So if you are with a member and they fall, then obviously you're tending to the member and getting them the care that they need, but as soon as possible, because if they've had a fall, we want to make sure that we're making sure there's not been a medical change, and same with declining condition. We want to make sure that we are getting, encouraging them to get out to the doctor, getting a care manager or the service coordinator in there to see them. So as soon as possible. I think the guidance is if it's non-emergent and it's not, that there's like, I think we defined it like essentially trauma-based immediately or within 24 hours. But with something like that, as soon as possible, as soon as you're able to get to that, that way we can intervene quickly and make sure that they don't have further harm.
So before I ask this next one, I think you and I, Shonda, because what this next question says is, do we contact the AAA for changes in the waiver service coordinator, or do we just have one contact? So I think one of the things I want to clarify is as we're moving into this, and trust me, in-house with us at the AAA, we've struggled with it in the beginning too, and we've just said it enough that now it's habit. But the waiver service coordinator is at the AAA. That will now be the role title. So those people that you know as a care coordinator or a case manager, that is now becoming the waiver service coordinator, and that's at the
Mhm.
AAA. The care coordinator is at the plan. So when you're thinking about who you contact, and who's where, we now have to switch that care coordinator, case manager type of title to the plan. And the AAA is now considered the waiver service coordinator. So this question is who do they contact? Do they contact the waiver service coordinator at the AAA, or do they contact Buckeye for changes? Or do they contact both?
We don't, there's no need to contact both. We don't want to like make more work for you all. So if the AAA is involved and this isn't about a waiver service, then you would call the waiver service coordinator at the AAA for a member that is aged 60 and older. Because they're going to be the point of contact. They are, as the name indicates, they are overseeing and coordinating those waiver benefits. So we don't want you to have to call them and us. If it's something that needs communicated, that they want to make sure that the care coordinator at the plan is aware of, they will do that. You don't have to call both people. So if the AAA is involved, then it's that waiver service coordinator that's overseeing their waiver services. That's who you call. And then, any collaboration after that, they'll reach out to the plan. Yeah,
Okay.
we don't want to cause double work for you all.
No, no. How often will Buckeye send a case manager to physically see our residents in the assisted living facility?
Assisted living, so they changed the what we call the acuity
Mhm.
schedule. And Jen, you probably help me out here. Most members now. So if a member is what we would call, and they changed their tiers now, tiers 1, 2, 3, and 4. But someone who is doing well, who is what we would call stable, not having a lot of acute issues, that is just kind of chugging along, no issues. They're going to be seen once every 6 months. And that's like what I hate to use the word average, but like just a traditional member not having any issues, they're going to be seen every 6 months. So in AL, that's usually where they fall because they've got AL staff supporting them. They've got that structured environment versus someone in the community. So I would say it's every 6 months. I'd have to pull the acuity schedule to double check that.
Yeah,
Um,
and so basically how it works in MyCare is every person who is MyCare eligible gets assigned an acuity level like we talked about as tier 1, 2, 3, or 4. And based on where they fall in that acuity level scale, that dictates the number of in-person visits, the number of telephonic visits, and those are coordinated between the case manager or care manager at the plan and the waiver service coordinator at the AAA. And so everything from telephone contacts to in-person contacts are dictated by where they fall on that acuity scale of 1, 2, 3, or 4. One being kind of those community well folks who are just functioning quite well on their own. Two being that lower level, and then four obviously being high acuity that will have several contacts. So we can't really, it's not a one size fits all type of thing now. It's very customized. And so it will depend on where they fall inside that acuity level. But you will potentially see both the care manager from the plan and the waiver service coordinator visiting your folks.
Yeah, and one thing that's a little bit different than the demonstration is there is because we kind of functioned when I care managed and waiver, and I worked with the over 60 population, so I worked with waiver service coordinators. We both would see on our schedule, but now the schedule is more intentional between the two individuals when there's two people involved. So as Jen said, you're going to see both of them. It should be that they're alternating. Obviously,
Yes.
either one of them is going to come in quicker if there's a change that happens. So if you notify us that, like we were talking about before, that decline, then they're going to be seen quicker than that. But depending on what's going on, sometimes we have folks that are sicker individuals and have more going on, and they're going to be up in those higher tiers to where they're going to be seen maybe every 60 days, possibly sooner if they have a transition to care, they go out to the hospital. Whatever we can do to, again, support them and, prevent further, issue, educate, provide that education, provide, that support to get them out back into their doctors. So yeah, on average though, it's going to be every 6 months that these members are seen.
Um, how do we report an incident to Buckeye? Online, fax, email, or call?
You're going to reach out to that coordinator, and there's a form that they fill out. There's a process that they go through. You're going to notify them, provide all of the information. Jen, do you all have a template form for information, or do you just kind of start with that initial information and then they follow up? The
That
service
is
coordinator would follow up.
that would be a conversation for one of our clinical team managers, and I don't know if any of them are on here. I don't know if Scott or Rhonda would hold that information. And let me see if I don't think Sarah, Carolyn, or Sheena are on here. So yeah, that's not a question for me.
Yeah.
Um,
So you're gonna initiate that conversation, whether it's picking up a phone and calling that service coordinator or care coordinator, or phone call would probably be best, or email. But you're going to notify them if something happened, if the member went to the hospital, if the member was a victim of crime, any changes, anything that falls under incident reporting. You're going to get that information to them as soon as possible, and then there's a form that they fill out that is the formal, line of information that goes into our internal department for it to be reviewed, submitted to the state if needed, and for our internal investigating. You just want to make sure with that information you include as much information, more than maybe what you think is appropriate. All that information that we need to make sure that we can, do that follow up.
so someone says, I have reviewed Buckeye's contract. How will we, and this is being asked from an AL facility. I don't know if there's a difference between facilities or not, but as an AL facility bill and receive payment, will our residents still receive set tier level daily rates? And then the second part of that is when do we receive payment and when do we bill Buckeye? What is billable, what is not? And can you provide an example of a denial or offset when billing? There's a lot in there.
Sure. Yeah. Well, I can't tell you how to bill. I can tell you the process to bill, but I can't tell you how to bill as far as what's included and all of that. That's outlined in the Ohio Administrative Code. As far as how you bill, so assisted living obviously is a waiver service, so that's going to be on a service plan. So when that service is initiated for that member, you're going to get an authorization. And let me rewind. When the service is initiated for that member on the service plan, they're going to work with you as assisted living, along with the assessments that have been done for the member to discuss what tier the member is going to be at. So that tier will be identified on that service plan. So when you get that authorization for service, you're going to get the auth, and then on that service plan, it's going to say tier 1, tier 2, tier 3. So you'll get that when the service is initiated, and that authorization will be, I think assisted living is for 6 months. So you're going to have a 6-month authorization. And traditionally, I mean, you bill, however you guys are set to bill. I will tell you on average, assisted livings, the norm for assisted livings, or what I have seen for assisted livings, I should say, is every 30 days, just like, long-term care facility bills. You bill every 30 days for that service.
So, and then when do they receive payment? Is that with,
Uh, the
within 60
payment
days,
is
90 days,
our target is within 30 days. Within
Okay.
30 days. Yeah.
Um, will EVV change our current delivery documentation process? We use Serve Tracker, which includes participants' signatures. Will digital signatures integrate with the EVV requirement you need for billing? Well, EVV is only personal care.
Yeah. Yeah,
So,
and AVV is a mandated state requirement to validate delivery of the service. So it would be separate from anything you do internally, your process internally as far as verification with your staff.
Sarah, did that answer or did we just confuse you more?
No, that answered it. Thank you. I think
Okay.
you answered it with the
Yeah,
paper signatures too, so I
Okay.
appreciate it.
yeah.
All right. Will the waiver facilities be required by Buckeye to have a quarterly or annual inspection survey?
No,
Okay.
no. We do auditing, but as far as like inspection or survey quarterly, no, no. No, we do auditing of waiver services. There's an annual audit where charts are pulled. But as far as provider audits, I don't believe there's a set schedule to that. It's just as the member gets pulled.
Okay. What is the provider requirement for staffing with Buckeye?
The provider requirement for staffing with Buckeye. Buckeye does not have a requirement for staffing. You would have to meet the requirement for staffing through the state of Ohio with your certification.
Can you, prior to signing the contract with Buckeye, produce the training manual so we know as a facility what we're responsible to comply with?
If you go onto, I don't know about providing like putting something in your hand, but if you go onto Buckeye's website, that is what's hyperlinked in that PowerPoint. You can click in and there's the provider manuals in there, the provider resources. You don't have to be logged in as a provider. That's, public information. So you can go on and take a look at that stuff before you contract. You also, you also can initiate or reach out if you have questions and you want to talk to a provider engagement account manager. You can always ask those questions as well. So if you want to take a look at those resources on the website and write down any questions you've got, you can do that. Look there and then ask questions ask questions of your provider engagement account manager.
Okay. Do you charge providers for contracting with you?
No,
All
no.
right. And here, oh, Chrissy, I love that you asked this because we have the same thing rolling in our head. How will we know if a member transitions to you?
Well, normally there's an
I'm
830 or
sorry that we laugh,
834.
but you have to understand where that's coming from.
Yeah, so that has been the most fun thing for the AAAs and for the plans. With this being essentially, MyCare has existed now since 2014. And then, the next gen, we kind of took that existing product and we tweaked it to make it better and took all of those lessons, or I say we, ODM, took all the lessons from, the past 12 years and said, okay, we're going to do this better. And so, they made minor changes. But for the most part, we've done this for all of this time. And so I did not expect with the enrollment files, the challenges that we've had. They are getting better. But we laugh because these enrollment files, like they have had, it's been really crazy. At the beginning of the year, it was very, you had to laugh or you're going to cry because we would get an enrollment file that had, the member, and then we would look and they weren't live in our environment and our EMR, and we're like, okay, so then we would get on the PNM and they would be on another plan. So they might show like on the PNM and like as one plan and on the enrollment file as another. But that being said, as the state works through those challenges, we get an enrollment file from ODM that shows who we have as a member. And then within a certain time frame, I think the guidance is 6 weeks, but we normally don't take 6 weeks to engage folks. But we start that active engagement and reaching out to, make contact with them and initiate assessment and stuff. But the 834 actually comes over to the AAA too, as well. So the AAA can see, who we actively have in waiver so that they can follow along. From a provider standpoint, um, honestly, it's you getting on the PNM, that provider network management, the state's website to, validate that with the member. You can see who they're enrolled with on the PNM. And then, uh, working with the plans and the staff contacting you. I don't know that there's an exact science to that, honestly.
There's not,
Yeah,
and unfortunately, people can change every month. So
yes,
it really makes keeping up with them a little bit of its own job. We're hoping what happens is once everybody cycles through and they find the plan with the most, coverage of their preferred physicians, coverage of their medications, coverage of their health systems, that it will settle down.
yeah,
But in the beginning, I'm afraid it's going to be a lot of work to try to keep track of who is where and their movement. So,
yeah.
how will missed visits be reported within what time frame?
Missed visits, I mean, obviously, that's not as strict as incident reporting, as strict guidance as incident reporting. As soon as you can let us know so that we can, what we do, either the service coordinator, waiver service coordinator, or the care coordinator at the plan is just going to follow up with the member, and make sure that they utilize their backup plan. They're also going to document that missed visit because, most importantly, to make sure the members' needs were met, they utilized their backup plan and they didn't have any, care gaps because of that. The other thing is during audit, if we're doing a waiver service utilization audit, and we see that on that service plan, this member's supposed to get Monday, Wednesday, Friday, 3 hours a day. And we go into audit and we see on a Wednesday that service wasn't delivered. We know that was because, the member missed service. They called you and said, hey, we don't need service, or we have a doctor's appointment or whatever. So it's really first and foremost to make sure the member's needs were still met and missing that visit. And then secondly, so that when we go in and do audits, we know, that's documented if service was missed, so that we know that that's not any other deficit, but what happened and it was identified.
Is there a portal to bill on?
Yes, there is, and I thought that was in our information, but yes, there is. You can bill through the provider portal, and that's a part of the provider orientation. They'll go through that and show you how to do that. So yes, absolutely.
When we were talking about missed visits, Samantha just said, I believe I misunderstood. I assumed the missed visit is home health.
Well, it could be, I mean, it could be another home health visit. It could be, either state plan hours for home health aid. It could be nursing, and then it could be personal care, which would be waiver or waiver nursing. Yeah, so any missed visit, if you're a provider and you're, delivering care in the member's home, yeah, we want to know if there's a missed visit.
So she also asked, do assisted living facilities have to report missed visits? At time, we may not even know that a resident had an appointment, so we may not know they missed it.
Yeah, when we say missed visit, we're talking about waiver service delivery or Medicaid. Again, those services where they're coming into the home and it's being delivered there. So with assisted living, it's not doctor's appointments. We just want to know if there's missed service because these are members that meet level of care for a nursing facility. So they're very dependent on these services to maintain their quality of life and their well-being. So if any of those types of services, so if they miss a doctor's appointment, yeah, we want to know that, then we can follow up. But when we're talking about missed visits, as far as like services, that's so that we can follow up to make sure that their needs are met and they don't have any care gaps. But if you're aware if they missed a doctor's appointment, that's handy too, because then we can follow up and encourage them to reschedule.
This one might be one I get to answer. How will our residents know that they need to pick an MCO? there are letters going out from the Ohio Department of Medicaid. They may have very well already received them. Um, if not, they will be coming shortly, notifying them of their change into MyCare, and needing to pick an MCO. If they do not pick an MCO on their own, Medicaid will pick one for them. And then if it ends up being an MCO that doesn't cover the services that they wish for it to cover, then they have that ability to change into a different MCO. Um, but yeah, Medicaid should be notifying them through letters that they are MyCare eligible, that they are a dual, and that they need to pick an MCO.
And the good news is from the regions that have already rolled out, the good news is, and I kind of had this in my mind too, when we were working towards 2026 in this rollout, because we got the rollout schedule, I think probably the fourth quarter, beginning of the fourth quarter last year, maybe a little bit earlier than that. The good thing is the way that they're doing this, they didn't want it to be like a August 1st hits and boom, like you got,
Yeah,
10,000 members. So the good thing of how they're doing this, they did this very intentionally. So the areas that the regions that have already rolled out, that first day of that month, what you will see then are the members that they were notified because ODM notifies them. They send them a letter, I think it's 60 days before, and they say, hey, you need to enroll in MCOP. Here's your choices, and they have that option. So if they go ahead and they say, oh, this is great, I'm going to pick, whichever MCOP. I would say Buckeye, but this year we can't say Buckeye, unfortunately. But we're going to act like we can. So, I choose Buckeye within that 60 days. Then on August 1st, I would be showing on your roster. Like on August 1st, my name would be on your roster and I would be with Buckeye. However, if they take the time, like Jen said, and they don't pick and it's the ODM auto picks for them, then that's going to happen within, I think it's 90, yeah, it's 90
correct.
days
90
after.
days. Yep.
So you're going to see this real gradual movement. So it's not like on August 1st, a bomb's going to go off and, and you're like, oh my gosh, thank goodness.
Yeah.
So it's a gradual movement. So even those folks that are passport home care waiver, they're not moving, like they're not automatically on August 1st. Everybody's going into
Yeah,
my care next gen
we keep
waiver.
saying it's not a light switch. So it
Yes,
isn't that on
yes,
August 1st, the light's going to turn off on Passport and MyCare is going to be turned on. It's
yeah.
going to be a slow trickle. They're guesstimating roughly 25% each month will slowly trickle over. And then you're going to have a group of people who don't select that Medicaid has to give them those 90 days to make a selection. And then after those 90 days, if they don't make a selection, then they're going to slowly kind of trickle over. So we're looking at one, you have to understand that for the rest of time, Passport's not going away. So for the rest of time, there's going to be this constant trickle of a few people every month transitioning over from Passport to MyCare as they become eligible.
Mhm.
And then number two, it's going to be this 25% is what they're guesstimating moving over. That's going to result in us having about a 6 month time period of slow waves of people coming. But it's not going to be a tidal wave.
Yeah.
So it's going to be this transition that just happens from like August 1st, till probably February, March of the next year. We're going to have these little waves of folks coming over from Passport to MyCare. And again, it's people who are dually eligible and have managed care managing both sides of their programming. So Passport's going to stay there. It's just going to be a very small population from here on out. And then MyCare is going to take over.
And yeah, and so and that gives you the capability as a provider to ease into this. So it's,
Mhm.
it's very intimidating. You guys have done this for a while, so it's very intimidating to come into something new like this. But the good thing is you're doing it gradually. So, work on getting your contracts, with and I would advise going ahead and contracting with Buckeye because again, if somebody moves in, and then, if you don't, even if you don't have anybody coming in 2026, come January 1st, you're ready to go, with Buckeye members as you go back into receiving new enrollment. But, initiate your contracts. It's going to take you about 60 days to contract with any of the MCOPs. That's about average. that, and just make sure that they're going to give you that guidance of what you need to contract. Make sure you line all that stuff and have everything that you need, get that in there, and then, you can go through that process pretty seamlessly. But the good thing is you don't have to be an expert on August 1st. You're going to have a gradual, as Jen said, a gradual trickle of people coming in to learn from. And, we each have our own systems, but, they're similar enough. Like, I think the major grasp for you all at this point is just that change and the difference from passport waiver and how that worked into MyCare. And really, that's a global thing. That's not just, specific. Each plan doesn't have their own process when it comes to that. We're all following the OAC and ODM's guidance. So that process of a service plan, the care coordinators, all with the exception of CareSource. I think CareSource has a group in the Northeast that is going to be fully delegated, but
Yes.
but
Yeah.
each MCOP, we're all doing the same delegation. So you don't have to remember, okay, well, Buckeye's 60 and over and CareSource is this or that or the other. Like, we're all the same. Like, the age guidance is going to be the same, 60 and older, 59 and younger. That delegation is the same. And then our processes, waiver service plans, authorizations, all of those are going to be the same. So, the good thing is you get to dip your toe in the water, you get to ease in. We're all here to support you. Each plan has been incredible, with outreaching, developing processes to make sure that we're engaging with the providers, because we understand this is a big change for you, and so we want to make sure that we support you, and help this transition and ease it, make it as easy as possible for you.
Will PNM be a live working document without a lag to track transition members?
PNM is the ODM's website, and it's a live environment. So it's the center of truth. I call it like the center of truth. So what they are showing is what it's going to be. And so even with the discrepancies with that enrollment file that Jen and I were talking about, you still could go on PNM, and that was the center of truth. Like, it will show. And usually all of those changes are first of the month changes. So, like, but if they know, so like, if I went on today's the 20th. If someone was moving, that was on Buckeye right now, and they were moving to Anthem 6/1, a lot of times I can go in, because the deadline for them to notify when they're changing plans is the 15th of the month. So I could go on today and I could see that effective 6/1, my member is moving to another plan. So it's going to be the most accurate. It goes, it's got the time spans. It breaks down each area of their benefit. It breaks down. You can even see Medicare on there as well. So it's a live environment, and it's up to date to the minute. I don't think there's a lag time with them with eligibility on the PNM. You'll see lag time from the PNM to the plans, because we have to get that information on the files that we ingest from them, and those come in, and then they have to come into whatever, like a electronic data warehouse. It like comes in there in the plan, and then it gets ingested into our EMRs. So we will see lag time, but you as a provider, if you're going into that PNM, you're going to see the most accurate information.
Is your pay rate the same as the AAA?
Pay rate is for waiver is set to the waiver schedule. So if you go onto the OAC, you can go into the OAC and see the fee schedules. And so the fee schedules are the same of what's OAC. So I don't know. I've never looked at the passport fee schedule. So that would be the only difference. If there's a difference in rate between passport waiver and MyCare waiver, that would be the only difference. But Buckeye pays at 100% of the waiver fee schedule. So what you see on the OAC and that fee schedule is what Buckeye's going to pay for waiver.
All right. Carrie has been waiting patiently with her hand up. Carrie, you want to ask your question?
I have a couple questions actually. So, and one of the things to clarify that it took me a minute to realize is that the reason why passport isn't going away is because you still have people from the age of 60 to 64 who are just Medicaid eligible. And then with MyCare, it's because they're Medicare and Medicaid eligible at the age of 65, correct?
Correct.
So I think sometimes that's confusing when you keep saying that passport isn't going away, but that's why it's not going away. It's because you have Medicaid and then you have people that are Medicare and Medicaid eligible at the same time.
Right.
And
And that's also why there's going to be a constant trickle of people
yes,
making
and
the
so it
transition.
took me a minute to
Yeah.
figure that out.
Yeah,
But then
it took us all.
yeah, so then yeah,
You
so
weren't
then
the
About
only
a
one
year.
confused, Carrie.
I'm still figuring, listen, Carrie, I'm still figuring it out. And I've been in waiver almost since the beginning of it. So, you are
and
among good company.
and I think the other thing is, I mean, we talk about the communication and we talk about the care plans, but aren't we still dependent on the area agents on aging to do that since they're getting paid to do that? Like you talk about prior authorization, that's not really going to come from, I mean, it's coming from Buckeye, but we still need to get that from the AAA, which we already do for Passport, right? Like,
No,
No,
isn't that what
no.
you're doing still?
The care
no.
coordinator at the plan has the authorization of service delivery. The waiver service coordinator at the AAA does not. And yeah, that's going to be an adjustment for us as well. But
Yeah.
when you look at the
So,
scope of work that was agreed upon between the AAA,
uh-huh.
Department of Medicaid, and the plans, the authorization of care rests with the care coordinator at the plan.
So what is the AAA doing then? Just
We are
recommending the care?
coordinating. I mean, it's exactly what it says. We are coordinating the long-term services and supports
Uh-huh.
that the individual is receiving. Now, Shonda mentioned earlier that somewhere in the state, and it's 10B or
Hmm.
10A, one of the 10s up in there, which is the Cleveland, Akron, Canton area. They are doing full delegation. Now, with full delegation,
Hmm.
that means that the AAA acts as both the waiver service coordinator and the care coordinator, and they take care of all services, correct, Shonda? This is one
Yes.
of those
Yeah.
places where
They're,
we get
So,
yeah.
confused.
Well, they're
so,
doing, so when you look at the waiver service court, it is confusing.
Yeah.
So with full delegation, so kind of the way that it's divided out, divided is not the right word, but the way that they collaborate, let's use that word. So the AAA, so anything to do with waiver
right,
services, waiver
right,
personal care, home delivered meals,
right,
waiver nursing, if that's the case. They're overseeing that and they're doing the assessments to
right,
identify the need for those waiver services. Then at the plan, that care coordinator, for a member that has both of those folks involved, they're
right,
doing the rest of the medical. So, like, being a liaison with the doctor, overseeing the medical side,
right,
overseeing Medicaid services for them. So, with CareSource for that group up in the Northeast, they're doing the medical and the waiver. So they're just
right,
doing the whole thing. They're doing
Right.
the whole shoot match, kind of
right.
like
So
somebody
So
that's
we're
under
so
60.
the
we're
role
only
the role the AAA has with the long-term services and support is we're going, our assessors are going in and doing the level of care.
sure.
Our waiver service coordinators are going in and doing those site visits, and we're making recommendations as to what the individual needs,
Okay.
and we're sending them to the plan. But the
Yes.
Okay.
plan has the final authorization.
Okay.
We're acting as the eyes and the ears in the home for the plan when they can't get there as easily.
Okay.
Yes.
So how are we getting these care coordinator plans then? Who do we get that from? The plan? By
From UM.
email? By
From UM. From UM. So
Okay,
either way, if
what's
it's
UM? You caught me
Oh,
off
I'm
yeah, I
guard.
sorry.
don't
Utilization management. So either individual. So if it's a member that's over 60
right.
and those waiver services are overseen by the AAA, or if they're under 60 and those waiver services are overseen
Uh-huh.
by the plan. In both of those incidences, the service plan, when it is completed, when those needs are identified and they're put on that service plan, it
Hmm.
comes to the waiver utilization management department. So just like in a normal, like in a hospital setting or a doctor setting, when they do a prior auth, it goes into a utilization management department. That's what happens with waiver. Waiver has its own utilization management department. And so no matter who's submitting that service plan comes into that waiver utilization management department. It's reviewed for necessity. And if they can establish medical necessity for that need, so this not only the service type, but the service amount, then that is authorized. They do a prior authorization for that, and then that prior authorization along with the service plan then is sent out to the provider.
So
So
we
it's
should expect an email from utilization management that says so and so is authorized for home delivered meals. Here's your care plan. We sign that and then send it back to utilization management.
it'll be faxed. So it'll be faxed to you. And once you get that, once you receive that, then you can get on the provider portal and pull that up. There's an assessment, and this
Mhm.
they'll go through this in the orientation.
Okay.
But there's an assessment in there where you acknowledge receipt of that service plan. I think there's like
Right.
maybe 5
So that
questions, like
in the
did you receive
portal.
it? Can you in the
Okay.
portal? Yes, you don't
Okay.
have to physically sign everything. Like we
Okay.
try to make it as easy as possible. So you're not physically signing that service plan and faxing it back to us. You can get on the portal, you
Okay.
literally pull that member up, you click through those acknowledgement questions, and boom,
Uh-huh.
it sends that back, and it's a part of their EMR. And we've got it in the record that you acknowledge that, and that's the signature.
And there's no way to get away from a fax though. I hate faxes. I don't know.
Right now, no, I'm eventually, I hope that we can become portal centered. Right
Yeah.
now, though, it's faxes. I hate faxes too. I think unless you've got computer software,
Yeah.
it's, and it's an actual old fashioned machine, then
Yeah.
it's can be a nightmare. I hope, I know that our other areas of utilization management have gone to a portal system. I'm
Uh-huh.
hoping that waiver won't be too far behind. But the thing is you can always go into the provider portal, into that member's chart in the provider portal, and you can
Hmm.
always find that in there as well. You can always go in under the assessments, you'll find the waiver service plan, and then under authorizations, you'll find the authorization. So, if there's ever any confusion or anything after that's been sent to you, you can always go into that provider portal and access both of those things in there.
And then, but you're still saying we have to, when someone, let's say we have a home delivery meal person and they weren't home for the day, we're still
Mhm.
communicating that to the AAA, not the plan.
If it's a member over 60, yes, because they're
Yes.
overseeing the waiver services. Yeah. You just would email them attempted delivery for member so and so, they were not
Uh-huh.
home, and then rescheduled or whatever. And then that way that waiver service coordinator can follow up with that member and say, hey, we see you missed your home
Okay.
delivery today. Do you have food? Like,
Okay.
are you using a backup plan? And then we're aware, of course, that they didn't get that delivery, and then what the plan is to get the meals to them if you're going to be in the area and at another time, or what you arrange with the member.
Do you have to, so if someone goes in the hospital and then they're back out, do you have to wait for another prior authorization then to get that person
No,
started? No?
no, they
Okay.
they hold the services on the service plan. They'll
Okay.
go in. There's on the service plan, you'll see it's like the procedure code, the description of the service,
Yeah,
and then
yeah.
there's what's called a scope. And in the
Okay.
scope is where it would say home delivered meals, 7 meals per week,
Yeah.
diabetic meals, cardiac
Yeah,
meals,
yeah.
like whatever it is. And so if there's a hold, they go into the hospital, or if they're
Yeah.
in any kind of hold, it gets documented in that scope. And when they update that, then they've notified you and said, hey, meal provider,
Yeah.
members in the hospital hold meals, and then I'll call to resume meals.
And
So
when you say
yeah,
notified, that's also a fax too? Or no?
usually the service coordinators will just call the
Okay.
provider and say,
Okay.
The
Okay.
only thing that I know, as far as fax is just the waiver communication is fax,
Okay. And then how do
in this
we
whole relationship.
get hooked up with the provider orientation? Do we just email Rebecca and say we want provider orientation, or because our contract's signed and I really haven't heard anything since then?
Yeah. Who are you with? I'll follow up
Washington,
too.
I think you have us as the Cap Corp of Washington Morgan.
The Cap Corp.
Yeah, it's Washington Morgan Community Action, but I think our
Okay.
name is Cap Corp or something we had to go with. That's how we were
Okay.
in the Medicaid system.
Okay. Washington Morgan. Um, okay. Would you mind putting your contact
Oh
information
yeah,
in
sure,
the
absolutely. In the chat.
and let me get that, because I want to make sure I follow, and I don't want to depend on having to dig through for your contact information
Okay.
in the system.
And then so what about monitoring? How will that work now? Does someone from the plan come out and monitor files and stuff, or we don't do that? Like, do we hold paper
Um,
files still, or that kind of stuff?
If you look at the OAC, in the provider requirements, there
Okay.
is it gives you guidance on how much of your records that you need to maintain for audit purposes.
Uh-huh.
I'm going to defer. I can get that information to you through Rebecca. I don't want to
Yeah, yeah.
speak to that because I'm not 100% sure.
Okay.
I know that our provider engagement account managers do interact with the providers.
Uh-huh.
As far as audit with the provider specifically, I'm not going to speak to that because I'm not
Okay.
100% sure and
Okay.
I wouldn't want to speculate.
Okay.
But as far as service utilization, we do, monthly service audits on our members that we have an internal audit team that does that. We partner with the AAAs 2 times a year, which we just initiated and for May, the one that is due at the end of July for our existing AAAs. That is a service utilization where we go in and make sure that what was on the service plan is what's billed and that
Yeah,
matches
yeah.
up.
Yeah, yeah. Yeah, yeah.
And then there's an annual audit, but all of those are selected. Like we get a population of members that it's based on that. It's not provider specific. So
Okay.
I can get that. I can get that information and get it back to you.
Okay. Thank you. I think that's all my questions.
Yeah.
Okay, we are coming up on time, so if we get disconnected, that's why. So one last question in the chat. It's been heard that Buckeye's only contracting with one provider for statewide transportation. Is that really the case?
We have a third party vendor that oversights transportation. So we use many transportation vendors, but they go through Safe Ride. And so they coordinate the transportation. So they will reach out to the providers to schedule rides. So we have several transportation providers, but Safe Ride is kind of that company that does the scheduling and the oversight for the waiver population.
So it is likely that you will use local providers to provide transportation. It will
Correct.
just be coordinated by the statewide coordinator.
Correct. And if
Okay.
you have a member that you have served, Safe Ride does have the capability to put the member's preference in their record that they keep. So once when they call Safe Ride or when the care coordinator or waiver service coordinator calls Safe Ride, they can see that they prefer XYZ transportation provider. So that's still member choice if they have one.
Okay, any last minute questions before Zoom ends us? This has been good. I have appreciated all of the questions. I've actually learned something.
Yes.
So I say that
Yeah,
like I'm
thank
the
you
smartest
guys.
person in the room, but it's been nice to learn some stuff. So,
I agree. I always enjoy learning, and I appreciate the questions. And by all means, again, we understand that this is a big different way for you all to do work for our members. So I am here to support this transition. I am here to support the AAAs. I am here to support the providers that work with the AAAs. So, this is my focus for 2026. This is why I am here. So if you have any questions, if you were maybe too shy to come off of mute, I get that. Call me. On that PowerPoint slide is my phone number, my email. If you want to email me and we'll schedule time together, I am here to support you. If you need more support that's outside, that's maybe more into contracting or, out of my area, we'll get, someone from contracting on. We'll involve anybody that we need to, but we want to make sure this is a smooth transition for you and that you are supported, during this time of transition.
and I want to thank everybody for attending. We have the next two versions of this with two other health plans already on the calendar. We're waiting on the fourth. Check our website to register for those. And then one of the most important things, I know we all get a million emails a day. Sometimes I don't know how I get so many while I sleep, but when Rhonda and her team, we're sending notices of these meetings and these education opportunities. You're probably getting them from Medicaid and whatnot too, but we're sending them out with alerts. And so when you see something from Rhonda and her team and it's about a webinar, we're trying to do our best to educate everybody, share it, join us, because this is important. What we don't know turns into a big scary monster. Been there, done that. I'm right here with you in the trenches. So just share it out, share it with your network, so we can all do this well. So any last minute questions? Lots of thank yous coming in, Shonda. So any last minute questions before we call it a day? Yeah. All right. Well, thank you everybody for attending. We really appreciate it. And talk soon. And thanks, Shonda. Appreciate you taking the
Thank
time.
you. Thank you for the invitation. Thank you everyone for your time.
All right.
Take
See you.
care.